Our Father in heaven, we thank you so much for this morning. We thank you for all the benefits of life. Indeed, we are grateful for everything you have done for us. This morning, we thank you for the gathering. We pray that you guide our thoughts and our discussions so that at the end of this meeting, we would have had enough information for the reform of the NHIF for Mother Ghana. We thank you so much for an answered prayer. May your name be praised now and forevermore. In Jesus' name, amen.
Thank you very much, Edna. So now you're all welcome specially to this very important program, the National Health Insurance Review Stakeholder Consultative Meeting. And it's the final public event in respect of the ongoing review of the National Health Insurance Scheme.
Your Excellency, the Vice President of Ghana, the Chairman of the Review Committee, CEO of National Health Insurance, the Chairman of the Board of the National Health Insurance Authority, distinguished guests, bankers, ladies and gentlemen, all other protocols observed. I'm not going to spend very much time talking. We all know why we are here. Mine is to try and moderate the affairs right through. The National Health Insurance has been topical for very good reasons, and it is a scheme that we are very proud of, and one that we intend to keep, and the President of this country has made it very clear that the National Health Insurance is here to stay. So it's important that the review takes place, that has taken place. I believe that it is looking at what we've gathered from other countries. The review of the National Health Insurance is something that should be happening at least every 5 years because of the way in which the demands on it or the changes in economic climates and the way in which it grows will always be a dynamic issue. So this is the first actual major review since it took place or came into being from 2004-2005. And actually it's overdue. And that is why we have certain issues that have arisen over the period. Once this is done, we will try and also fit into the timetable when the next review should take place in the future. So on that note, I would just say, I hope the deliberations are full. I particularly mentioned bankers because they are the closest to the money. And I'm also hoping that all the other stakeholders get involved, both development partners. I've even seen people from the military. So we have a room full of everybody who actually benefits, including some of the beneficiaries here, even though we are all technically beneficiaries of the National Health Insurance. On that note, I thank you for making me the chairman of this occasion, and let's have fruitful deliberations. Thank you very much.
Thank you very much, Chairman, and thanks for accepting to chair this program. We also want to hear from the board chairman of the National Health Insurance Authority.
Your Excellency, the Vice President, Honorable Minister of Health, Chairman of the NHIS Technical Review Committee, members of the NHIS Board and Management, distinguished ladies and gentlemen. On behalf of the Board of the National Health Insurance Authority, I wish to extend a warm welcome to you all to this very important event, which is to enable the committee set up by His Excellency the President to review the technical, financial, and operational framework of the National Health Insurance Scheme to familiarize with stakeholders, decision makers, and the general public on the activities so far undertaken and the trend of the conclusions emanating therefrom. In 2003, Ghana decided, as part of the nation's social revolution, to establish a national health insurance scheme. The scheme has since then grown in terms of its size and stature. Indeed, the scheme has become the lifeline for many in the country, especially the poor and vulnerable. This notwithstanding, there is a need to re-engineer the scheme to ensure that it meets our aspirations as a country to improve health outcomes, protect the population against financial risks of seeking health and insurance, and ensuring customer satisfaction. Your Excellency, Mr. Chairman, it is my hope that this forum will help shape the direction of the review process instituted by His Excellency the President by providing the critical inputs required for redesigning and realigning the scheme to ensure its sustainability, efficiency, accountability, and user acceptability. The Board of the Authority looks forward to fruitful deliberations over the next 2 days that we are going to be here. Thank you.
Thank you very much, Board Chairman, NHIA. Your Excellencies, it's time to receive the official welcome address and to actually tell us the main reason why we are here. And to do that is the Chairman of the National Review Committee of the National Health Insurance Scheme.
Thank you very much, and good morning to everybody. Mr. Chairman, Your Excellency, Vice President of the Republic and keynote speaker, Ministers of State, members of Parliament, should recognize that the Chairman of the Parliamentary Committee on Subcommittee on Health is here. Directors and staff of the Ghana Health Service, the leadership and staff of CHAG, and private sector providers. I think that right from the start we should recognize that we have a lot of hardworking and patriotic professionals and staff in our GHS, the CHAG, and the private providers. And we should never forget that, especially in fora like this. Development partners and CSOs in the health sector, board members, chief executive and staff of the National Health Insurance Authority, representatives of key beneficiary groups and statutory taxpayers of the NHIS, esteemed members of the media, distinguished invited guests, ladies and gentlemen. On behalf of the NHIS Technical Review Committee, I welcome you all to this final National Stakeholders Conference, which represents the culmination of our 9-month NHIS review process. In September 2015, the 7-member committee, which I've had the honor of chairing, was inaugurated by our chairman of today and Honorable Minister of Health, to begin its journey to conduct the first ever root and branch review of the National Health Insurance Scheme set up more than 12 years ago. The process entailed extensive desk reviews, meetings with individual stakeholder groups and key informants, public fora in the three zones of the country, and fact-finding visits to more regions and districts where we met and interacted with facility and NHIA staff, as well as patients and scheme members. In addition to these activities, our review involved setting up 7 technical subcommittees comprised of some of the best and brightest brains of our country to analyze and advise us on various thematic areas. Mr. Chairman, after 9 months of intensive consultations and evidence gathering, as well as the review committee's own deliberations in line with our mandate, there are 4 key messages or recommendations for the government's attention that we want to highlight today. We are recommending, 1, a universally guaranteed primary health care package for all residents on which the limited resources of the country should be focused. 2, a guaranteed maternal and child health package at all levels of the health system, subject only to certain cost containment measures that we explain fully in our report. And I hasten to add that those cost containment measures will not impose financial burdens on the beneficiaries in this case. 3, empowerment of NHIS beneficiaries and members through what we are calling actively informed and involved membership. And 4, improved governance of a more accountable and efficiently run NHIS, specific details of which we detail in our report. Mr. Chairman, the committee's recommendation of a universally guaranteed primary health care package of services, if accepted, means that possession of the NHIS card will no longer be a precondition to access the primary health care package, though identification will still be required. Membership of the NHIS will only be required if the service sought by the person is outside the primary healthcare basket. This universally guaranteed primary healthcare proposal ensures an alignment of the NHIS with Ghana's most pressing public health problems and the available resources. It provides a reprioritization toward universal access to primary healthcare in the medium term and progressive realization of universal access to high levels of the system in the long term. The fundamental premise of this redesign is that the NHIL, that is the earmarked 2.5% VAT, which is the most important source of financing for the NHIS, is collected from all Ghanaians and should be used to provide services that benefit all the population and not just a minority as at present. In order that this recommendation does not lead the NHIS to the same pitfalls of the free healthcare system of the immediate post-colonial era, individuals must identify themselves at the health facility with any recognized national identification document in order to access the package. This is to help track utilization, data about which the providers must transmit to the NHIA whether the service is capitated or not, and to minimize abuses of the system. Notably, by this recommendation, the review committee is seizing the opportunity offered by government's ongoing focus on CHIPS zone expansion and reinforcement to redirect resources and efforts principally towards primary health care. Mr. Chairman, although Ghana has made strides in improving maternal and child health care since the introduction of the free maternal care under the NHIS, the nation still has a long way to go to reduce our maternal and child health indicators to where they should be for a country of our income category. Hence, the need to refocus the NHIS to give greater impetus to this objective. Mr. Chairman, we also think that without an informed and active membership of the NHIS, many of the suggestions that the review will be making may not be fully realized. To achieve this, we think first, there is a need on the part of everyone in the NHIS, especially the NHIA, to recognize that the NHIS beneficiaries are not its subscribers, but members, as is clearly spelled out in the 2 Acts of Parliament that set up the scheme. Membership is empowering. Subscription is disempowering. I would like to remind participants that our recommendations are meant to address both short-term and long-term structural issues in the NHIS. We are not suggesting that everything should be done next year or the year after. We are trying to design an optimal or redesign an optimal system for the long term. A separate implementation working group that the Honorable Minister and the Chairman has asked us to help to set up will be looking at the appropriate timelines and the phasing in of the various recommendations, as well as the challenges that need to be addressed at each stage. I particularly want to remind the media here that these are our expert recommendations and proposals. They are by no means government policy at this point. In conclusion, the NHIS is indeed the best and largest social intervention in Ghana's history, and it behooves us to redouble our efforts to make it one of the best legacies that we can bequeath to later generations of our country. We therefore owe it to ourselves, to our country, and to unborn generations to ensure a sustainable and more responsible NHIS than we have today. The more reason why the theme that we have chosen for today, towards a more sustainable and accountable NHIS, could not have been more appropriate. You are once again welcome to this National Stakeholders Conference on the technical review of the National Health Insurance Scheme. Thank you very much.
Thank you very much. At this time, we want to proceed. And as you heard, there were a number of emphasis on maternal and child health, amongst others. So we want to take an address from the Greater Accra Regional Director for Health.
Vice President of the Republic of Ghana, our dear nation, my Honorable Minister for Health, the CEO, National Health Authority, Chairman of the Technical Review Committee, and his wonderful members, as he's told us, the Chairman of the NHIA Board, Honorable Deputy Minister at the high table, my sister, leaders of the health sector, development partners, distinguished ladies and gentlemen, all other protocol observed. I believe that this morning all of us must be grateful to His Excellency, the President of the Republic of Ghana, for commissioning such an important program, because this is very, very important. And I also want to express my gratitude to the organizers for asking me to talk about putting maternal and child health as well as equity at the center of a reformed NHIS. And we have heard from the chairman, Dr. Chris Atim, about all the things that need to be done, and I'm happy that I can just add on. I want to wish all fathers a happy Father's Day. And they are telling us that they are all involved. You see, we talk about the women and children, but the fathers are involved. This is a real picture of a man who carried his child to the hospital because the wife was busy. So you see that when maternal and child health goes very well, the fathers will also be happy. As an introduction, we know that pregnancy is physiological, but annually worldwide, women, as they strive to give life, 830 of them die daily. But there has been a lot of reduction, and 44% is huge, because to reduce 1%, I believe, is a lot. But we still have a lot to do if we are going to reduce it to about 70 per 100,000 live births. And I believe strongly that what we are doing will help us to move forward. Unfortunately, ladies and gentlemen, annually, a lot of babies die. If you put the stillbirths or the babies who die at birth and those who die within 1 month together, we are losing about 6 million. And unfortunately, about 99% occur in developing countries. Now, Ghana, we have done well. We have reduced our maternal mortality drastically. However, in 2015, as a country, those who came to us, we lost about 926 in absolute numbers. And the causes are known, mainly from bleeding, pregnancy-induced hypertension, obstructed labor, and unsafe abortion. But many of these are preventable, looking at our work, but also avoidable from the side of the people who come to us, because there are cost-effective interventions that can be used. But all this will work if the system is strengthened, and we also have a universal health coverage, which we are now looking at. Here, Honorable Minister, His Excellency the Vice President, I think that as a service and as a country, we need to improve on our gender sensitivity in terms of health delivery. Not just about us providing the health, but the women coming to the facilities, because some of them do not do this. Now, it also depends on essential service package. And now, looking at the primary health care, you find that this is very key. And improving access to care, and we have heard about the CHIPS, and eliminating financial barriers, which is actually what we are trying to do. Now, also of importance is the social barrier, which is a big issue in our country. And monitoring and performance appraisal and all that is something that will add to accountability. In sustaining our gains, the free maternal services should continue, and it should be respective of wherever you are. But then the health providers, if we are asking for this, we must also be accountable for every pregnant woman and every newborn, irrespective of the level of care, whether you are at the teaching hospital or at the CHIPS compound. And all pregnant women and children must receive the same quality of care, irrespective of where they are. These people are calling for help because they have left everything that they are doing. If you see the back here, they were working on their cocoa, but they had to leave to help this pregnant woman to get to the hospital. A reformed NHIA should be such that we as care providers will walk along every difficult place, every channel available to meet the people who come to us. Now, the outstanding issue, that's the last point, is that there are some hindrances. Some of the medications are low priced compared to what they sell outside. And cytotech, which is used quite often, is not covered. If a cesarean section is performed in the government facility, it is paid lower than at another place. And that affects our referral. Ladies and gentlemen, there are other things which I believe that we need to address, but expert advice must be looked at. The way forward is that there should be full antenatal coverage for every person. It should not just be 4. and I believe that the team has looked at it. There should also be the human resource factor, where as a service we look at what we need to do. Our data, as we capture and use, we must be able to display and share results. So no woman should die while giving life, and every child must enjoy a healthy childhood. Thank you very much for your attention.
Thank you very much. We want to listen to another mother on the table, high table, and the person of the Deputy Minister for Gender, Children and Social Protection.
Very good morning to everybody. Your Excellency Pa Kwesi Emisasa, Vice President of the Republic of Ghana, the Honorable Minister Chair, Honorable Deputy Chief of Staff, my colleague members of Parliament, the Chief Executive of the National Health Insurance Authority, the Chairman of the National Health Insurance Authority Board, Chairman and members of the review team, development partners, CSOs, distinguished guests, the media, ladies and gentlemen. I extend very warm greetings from my Sector Minister, Honorable Nana Oye Lisa, and also her apologies for not being able to be here for an issue which is very dear to her heart. She is currently participating in another equally important national assignment. It is a pleasure for the Ministry of Gender, Children and Social Protection to participate in this meeting, and I wish to thank the National Health Insurance Authority for the invitation and to commend them for the initiative to review the program with the objective of addressing the challenges we are facing as a country. Honorable Chair, I want to thank Dr. Linda for her brilliant presentation. Every minister responsible for children and women will be very pleased with what she said, with the plans which are underway. She has spoken a lot for us. But I want to start by sharing my favorite story, which is a story of a little girl I met not too long ago. Her name is Melissa. Melissa had to have both her legs amputated, perhaps because of the negligence of her parents, whose excuse was she was not registered on the NHIA. Melissa, as a result of that, lost her bright smile. It's a very sad story. Excuse me. The National Health Insurance is one of the social interventions being implemented by the government of Ghana to make healthcare accessible to all Ghanaians and people living in Ghana. For us as the Ministry of Gender, Children and Social Protection, it secures financial risk protection against the cost of healthcare services for all. It is one of the key social protection interventions which addresses the health component of the social protection floor in Ghana, protecting especially marginalized and vulnerable, of which women and children are in the majority and are not likely to participate and benefit equally from the gains of development unless a conscious effort is made to ensure their participation and enjoyment of the benefits of socio-economic growth. As a ministry, with the mandate of addressing issues of poverty, vulnerability, and exclusion for all age groups, including gender, children, working age, and the elderly, we have a major stake in the implementation of the National Health Insurance. It is in this light that we see our participation in this review process as a very, very important one. We have in the past years intensified our collaboration with the National Health Insurance Authority to expand registration to the extreme poor, the vulnerable, and the excluded progressively. These categories include persons under 18 years, persons over 70 years, and persons who are LEAP beneficiaries, persons with mental disorder, children under the Ghana School Feeding Program, prison inmates, inmates of care homes, orphanages, inmates of the country's leprosaria and psychiatric hospitals. We are currently covering approximately 1.4 million in the exempt category. The ministry, with the collaboration of the NHI, is also currently working with the International Finance Corporation of the World Bank, Marie Stopes International, and Farm Access Ghana under the African Market for Health Equity program. We are registering the extreme poor in the Ashanti, Upper East, Eastern, Greater Accra, and Volta regions to have access to health care. The program targets a minimum of 150,000 beneficiary households. Honorable Chair, there's no doubt that the inclusion of the exempt category puts a lot of financial pressure on the scheme. I know some people may have the view to propose a second look at the exempt policy. In terms of economics, they may be right, but I wish to sound a caution that in taking this stand, the review must be done with the following context: mothers, children, orphans, disabled, and the elderly need health care. Without any social safety net, they will be exposed to market hazards if we should allow the market to determine what services they benefit from. We therefore have to find innovative ways to determine packages that these categories of extreme poor and vulnerable will receive. Honorable Chair, the Ministry of Gender, Children and Social Protection is advocating that we have to do this based on the principle of equity, and also to ensure that the National Health Insurance achieves its equity objective of equity in health care coverage, access by the poor to health care services, and protection of the poor and vulnerable against financial risk. It is in this light of the above that we at the Ministry of Gender, Children and Social Protection view our participation as timely in addressing issues